Hi everyone, today is day 2 of our GoLive at the St. James Medical Complex, the National Radiotherapy Center, or like I like to call it in all of my videos, the National Cancer Center, because they provide both chemotherapy and radiotherapy in Trinidad and Tobago. And now we can say the system is well and truly live, and I wanted to do a quick debrief session with our key management team on the ground. And we thought we'd record that and bring it to you. So I just go around and introduce everyone very quickly. So we have Mohit, who's a development manager on our team and also a key designer. He started by playing an immense role in the pharmacy part. Like he would often say that pharmacy is my baby, and it actually is. And he's gone on from there to play a big role in getting the whole system together. We have Shivangini, who's running media and communications for us. And she's responsible for bringing all these videos together, and she's been also helping with training on the ground in terms of helping out the medical staff and the physicians with using the platform. We have Camille.
Greetings.
Yes, and Camille has played an immense role. She's instrumental to bringing this all together. She started working with the Universal Health Information Network and Transform Global Health almost from the inception. We've been working together for over a year and a half now. And I think she's one of the first people who got involved after our team came up with the ideas and brainstormed this. And she's also a Trinidadian. Did I say that right?
Yes, absolutely.
Yes. And she is, of course, very attached to her home. And she brought the Northwest Regional Health Authority, NWRHA, together with us, which made everything come together.
Absolutely.
All of you know me, I'm shook, but I'll say that anyway, right? So I've been architecting the platform overall. I'm also the solution architect behind Transform Global Health and the Universal Health Information Network. And what I also like to say is the program director. So I'm kind of coordinating the entire effort together and also designing it with help from Mohit and Shashwat and several other people who are not mentioned right now. And we have Magda. Magda is a very key member. She's from Northwest Regional Health Authority, and this project would not have been possible without her. The reason I'm introducing everyone also is because often they don't tell about all the wonderful things they've been doing, but I won't be shy about that. And Magda has been taking care of all communications, coordinating everything for us, and essentially being the project manager for Northwest, and has played a full project management role. If she had not brought us all together, help us coordinate across all the groups, and then help us with change management and get everybody on the same page, this project would absolutely not have been possible. So thanks, Magda, for being here. And then we have Kiran. Kiran works on mobile solutions for us. He's also helped us with the overall platform. He's been training people on the ground, and he's also helped us with testing the overall system, right? More than he's played an immense role in that. But he's also putting together the iOS mobile app. Actually, both the mobile apps. He's managing our iOS and Android teams. But he's putting together the mobile app that we're very excited about, and that's going to integrate with this platform and make it more patient-centric. Alright, so with that, I'll get started. We'll keep the format very simple. I just want to ask everyone their thoughts for the day and how things have been going. And we'll start with Magda. So Magda, if you don't mind, just take a moment to just tell us a little bit about yourself, about how you came about working Northwest, what you do for Northwest, in addition to the project, because this was just a project for you, but there's a lot else that you do with the organization.
Thank you for the gracious introduction. And again, this is a full team effort. My name is Magda, Baksh, General Manager, Health Policy, Research and Planning. I am in charge of the section that does a lot of policy and planning, but also research. So we have the Public Health Observatory under me, as well as the Policy and Planning Unit, as well as the Health Promotion Unit. So wellness and prevention of illness is key in my role. And so I came on to the project as part of the planning aspect in terms of how do we improve efficiency, how do we improve patient care and patient quality in the NWRHA, and more than that, being data-driven. So key to policy, key to planning is having the data readily available to make key decisions. So making decisions and making policies through evidence. And that is critical in modernizing the health or the hospital information system. So now we would move from paper to electronic, and then you get that readily access to key information regarding patients. So you're no longer doing something retrospectively. You can now plan your policies and initiatives based on real-time information and real-time data. My thoughts for the day is that day 2 has been hugely successful, as well as, starting from January to now in July. This is huge. This has been, just a step in the right direction, and what the authority has been waiting for so long. How do we modernize what we're offering, and how do we modernize our hospital information system? So going live in pharmacy in May was critical, but then now going completely live with a comprehensive electronic health record for all our patients in the NRC, our oncology patients. And so giving those oncology patients just a critical pathway to now access the information is really key to us, and it improves this whole pathway of having the right information available at the right time to the right person. So I'm excited about what we've done. I want to say especially congratulations to the NFT team for, just a revolution that you have brought to the NWRHA, and just a huge success. This has been a significant occasion, and we are so excited about this platform and about what we can now offer patients. And going into the launch of the mobile application, you know how excited I am about that.
Yes.
Because not just capturing our patients here at the NRC, who would now be able to access their clinic appointments, which is key, and getting those clinic reminders, but with accessing their prescriptions, and now our pharmacists and our physicians can now look at their compliance, and that's especially critical for our chronic patients. So having patients with NCDs can now look at their medication compliance, and that's a key step in prevention and control of non-communicable disease. And the burden of NCDs is so high in Trinidad and Tobago. And then another aspect of the application as well, of course, targeting the well population. So not waiting for them to manifest as very sick and ill in the NRC, but catching them even before then. So early detection and then early screening, of course, but prevention is always better than cure. And with the app, we're going to be able to have a patient-centric platform, of course, for our patients, but then the wellness platform, which is key and critical for prevention.
Absolutely, and that's why we're so excited about, because it puts wellness together with making patient-centric, and that is just, we're so passionate about that, so it's really exciting for us. And Magda, this has really been a team effort. I was telling Dr. Kisoon as well earlier that without his inputs and inputs from several of the other key doctors and how they helped us design the system and follow their process, it would not have been possible. And I think in practice what we're finding is what we tried in that aspect definitely worked, in that the amount of training required has been minimal, I would say. Would you agree with that?
Definitely. So having the physicians, having the medical records staff, having the pharmacists able to say, this is what I would like to see, and your team being so flexible to say, we would adopt these changes that you have suggested, we will make adjustments in the system, and then following all of these staff members along to see, how they do their workflow, and then making this in electronic form, and then improving the processes to make that workflow more efficient has been critical. But just that interaction, and so having the support of your team to the clinicians, to the medical record staff, to the pharmacists has really helped the adoption. So now they want to partake because their voice is being heard in the development of the system, and they have only kudos for the team because the support is so excellent and it's in real time. So whether they have a question during the day, whether they have a question at night, it's 24/7 support, and they love that.
When we met in January for the first time, did you think we'd be spending so much time together and do something so special by July?
No, I had no idea. From the first, I got the scope of the UNHIN, and to now it has been just a transformation. And truly transforming global health is accurate because that's what it's been. And just the time frame from January to July, that's a tremendous body of work that normally hospitals would take years to accomplish. And accomplishing something like that in a matter of months in a limited resource setting is truly an achievement. And having the support of all of the end users is also a significant step, because nurses, medical records, doctors, they are in love with the system. They want to use it. They want to learn. People that don't know how to use it want to be on board with it. And even when we visit other sites at NWRHA, they want to know, when is it coming to them? You've seen that when you went to the lab.
So great.
When can it come to us?
For us, I think that's the most fulfilling part, seeing them actively participate in and like we said, all along, our journey together has just begun. We put it live, so we've been observing, right? So everybody's been observing how people are interacting with it. We've been getting inputs. We're going to make incremental improvements, and that's the main thing. You have our support, and we earnestly and truly just starting together with this journey. Okay, awesome. So let's talk to a few more people. Camille,
Yes, ma'am.
how does it feel?
Well, I think it's wonderful. I think if I were to sum it up, to follow up to Magda's point, we have truly redefined the definition of partner in the PPP model, which is the public-private partnership model. That as partners, we really have come forth to work on a sustainable basis with, NWRHA, and really from the outside looking in, because this is the first project in which I've been engaged from the ground up. It really has been a situation where one didn't just come in and say, okay, this is a system, you work with this, and we'll work with you. No, we literally took it from the ground up. And that I thought was very important, because at the end of the day, we are working with individuals and we have to foster trust and relationships. And this approach that we adopted of coming in, of talking to the nurses, talking to medical records, to the doctors, getting their input as to what are the challenges they have and what is it that they would like to see, and listening to them, and also tuning into the forms that they currently use. So all we need to do is shift what is paper to electronic. That helped really to facilitate the adoption, because it is a system that they're familiar with.
Yes.
And so this truly, I have heard, several folks say, senior IT executive says, I've got to tell you something. I said, what is it? Well, typically something like this takes 2 years. You all have done, this was with the farmer module. In 3 months, you all have executed this. And when you executed it, from day one, it started. And the tweaks are nominal, they're not significant. And the tweaks that you're making them almost on the fly. This is unheard of. And so when I compare what we are doing relative to other sources too that I've heard about, it's also to the team shop that you have. That the team, they're on the ground, they're truly accessible 24/7. It is not that one team that has to be working with another. It's not a chain of subcontractors. It is literally an FT. We're all together. And that really brings in, if you may, an ownership too of the project. And again, to sum it up, I just think we have totally redefined the PPP model. We are a unique partner, and to quote the words from Mr. Gilchrist, we are now going to institutionalize this new PPP model, because at the end of the day, the seed has been planted with Northwest, but we don't plan to stop here. We really seek for this to mushroom and grow throughout all NWRHA, all the other RHAs, the Caribbean, right, and beyond. And so that's because it's at the end of the goal, the plan is UNHIN, where it's universal across the globe for all, with patient-centric data that is provide intelligence and help at the end of the day transform global health.
Yes. And Mr. Gilchrist, who we refer to is the CEO of NWRHA.
Yes.
And how does it feel being instrumental bringing this back to your home?
Well, it's wonderful. It's absolutely wonderful, right? Because at the end of the day, I have the luxury living in the United States to see systems that are the best of the best. And to the extent that one can, in fact, bring this back, be a bridge to bring it back home, all boats rise from that point of view. We all benefit.
And Camille's also been playing the role of a senior business analyst for us, helping us figure out the processes, making notes, talking to people, helping figure out how to put the system together. So I know you've not worked in an IT system earlier. And I, for one, always say, I value talent as much as, at least as experience, right? So whenever we're looking for people to work on the system, if someone's really passionate about that and has the talent for it, they usually do a tremendous job. Even though Camille had any experience with IT systems, she's done fantastically in that. So how's it felt like to play a business analyst?
Well, I think at the end of the day, it is about processes, right? Mm-hmm. Look, whenever I look into a project, it's about putting your time and your money into it. and at the end of the day, it's putting your time and money into individuals. So AAA, really, I think, we will definitely be knocking to borrow from the cricket. It's hitting sixes, continuously hitting sixes. That's what it's all about.
Do you feel like you're more business analysis after it? Has been exciting?
Well, it's more than that.
Yeah,
right?
it's a lot more than that.
It's absolutely.
But that's the IT specific part of it.
Yes, yeah, absolutely. Sure.
Absolutely. All right, let's talk with Mohit. Mohit, how do you feel?
I feel like from the day to.
Well, tell me first, how do you feel about this current, putting the whole system like that?
The system is performing very well, so I feel very great about it.
Mm-hmm.
Yeah, so I was observing all the nurses or the doctors' interaction with the system, so they are adapting very quickly to the system, so which was very good. So when the system behaves like exactly the way they work, so which is very intuitive to them. So I feel very good in design part.
Yes.
So I feel very good about it.
That's excellent. And this has been the biggest project you worked on, right?
Exactly.
Right. You've done a couple of large state government projects for us. We won't mention the client names, right? So that we don't cause the conflicts with the video. But you work for your state government clients in doing some of the work, and you've done other applications which you've done globally, right? So, but I think this has been the biggest project you worked on, right?
Because this is like directly linked to a patient, right? Because the work we do is directly impacting the persons. Like we see the transformation, right? Like with the app, with the portal, we will have the data to like as Magda said, right? Prevention is better than cure. So we can only achieve that because if we have the data.
Right.
So I feel that.
And so first overseas trip.
Yeah, exactly. This is my second actually.
Now it's a second year for pharmacy.
That's correct.
And pharmacies was I think very special for you because like I mentioned earlier, you actually did design that. You took a lead in designing that. So I did inputs and Shastra's not here right now. Both was provided inputs, but you pretty much ran with it. Right? So how did it feel? How did it feel to get put all that together and then come here and actually implement it?
So actually we designed it. So I feel when we made it live, right? So like this is close to my heart, seriously. Yeah. So when we made it live, so like there was a part of me like it felt very happy. Okay, I have done this.
Yeah.
Yes. And the people use it like very happy. They're very excited about it. Like they here, right? Is the inventory manager.
Yes.
So like he's very happy about it. So he manages the inventory very well. He messages me sometime like over when I was in India also about the system, like how it's working, it's looking nice. So that feels very good when someone appreciates the work.
And what about from a learning perspective? Do you feel you learned when you designed something in a labs in a development center when it came and actually saw it implement and work with users?
Yes. That's plays a very important factor when you with the people like who will use it. So you want knowledge about that, like how they will adapt to the system. So you can make your system better. Like that. So these inputs you cannot get from it.
And what about putting it in production?
Yes.
I'm bringing some of those things up, because one of the things which we do is I love mentoring people. And Mohit has started taking lead role in mentoring our young engineers who we hire in India. So I like to talk about all these because I always say every engineer should go out in the field and see how the platform really works and put it live. That's when all the little issues start coming out of shop. Right? So how's that learning experience been?
Learning experience, like we get to solve problems real time. Yeah, so the person says like sometimes the system doesn't behave properly.
Yes.
But we adapt it to like in real time. And we know, okay, this is what exactly the person needs. So we have to like solve the problem like this, like that.
Yes.
So that's the learning experience I get from it.
So now you know what it's like to be under the gun, under pressure, right? With the user right next to you.
Yeah.
Not just by the background support, right?
And the point, because one of the drivers is the patience at the end of the day, right? When you see these rows and rows and rows of sick patients, we know that time is not with us. And that to your point, like this, if you can actually come in and facilitate the execution and solve the problem, then the patients at the end of the day benefit.
That's it's useful to impact of the field, right? That's always been very special for me.
Yes.
Alright, let's talk with Kiran a bit. Kiran, So tell me first, what have you been up to all in all?
With the system,
Yes.
I had a very great experience implementing the system, especially interacting and training the different
Yes.
staffs
Mhm.
and understanding their feelings while they implement the systems. And I had a very good experience with the patients also expressing their joy, how system helping their what do we say, their medical process getting very quicker and easy.
Okay.
And I had a very good experience with one of the patient, and that lady have shook the hand about saying that you people have implemented a very good system. I need not carry a paper. I can directly go to the
Was this one of the nurses?
It's one of the patient actually.
Okay. Oh, wonderful.
One of the
Amazing. That's
patient.
amazing.
And where I was little worried about senior doctors, how they feel about the system and all. And I'm very, very happy that they have adopted the system very quickly. And they are very, very happy to implement the system. And I have seen people approaching that when we will get to use the system. And I have seen the nurses also feeling happy that here on we will not have to carry your papers. Everything will be online. I will not write anything. So that makes me very happy that our system, I'm part of this system. And I really appreciate the confidence of Sam and his vision.
Sam
and
is
his,
Sam.
and his patience actually. I really appreciate Sam. And I'm thankful to you because you have involved me in this, okay, in developing mobile app or in testing this environment and putting me into this training or guiding the people to use this one. I'm really thankful for you.
Well, you're most welcome. Now, when you were flying from India, right, you kind of knew what the project Mohit had come home after pharmacy implementation and told you a bit about it. Did you expect this, or was it different than what you expected?
No, Sam. I really felt happy when Mohit have shared his experiences because sitting somewhere and analyzing something and designing something which might not be very near to the expectations of the people who use it. But when Mohit have come here and shared his experiences, I really understood that it is totally different when we go to the people who use the system and understand what they need, and designing that is really challenging and that is very interesting. That makes you forget the pains what you are taking, and it doesn't make you feel like you are extending beyond your limits.
Right. Because you want to just make the system work really good, right?
Seriously.
No matter what you have to do.
Yes. It's been a week I am here. I never thought of sleeping.
Yeah.
And seriously, I'm not.
Yes.
I'm not telling for the sake,
Yes.
but this is the truth actually. I don't see even when just I have tested, understood the system. I am feeling this. Okay, how much the people who have really sat and spent more time even than me, how should they feel this?
Right. But building technology, especially in information technology systems, requires a lot of sacrifice.
Yes.
From the team, right? And that's not just something which I'm saying. I'm actually copying Bill Gates. He's one of my favorite icons in the world of software and technology that I look up to, along with Steve Jobs and a few other people. But I don't just like to just know a bit about them. I've studied them in depth, and he's very candid. Doesn't do a lot of PR. He's always said that developing IT systems requires, especially new technology in this space, requires so much sacrifice from the team. And the more projects I do, the more I feel that.
And I feel today everyone's hard work is paid off in these 2 days. I really feel that.
Right. And a lot more to go, right?
Yes, and a lot more too.
Yes. Yeah, but and mobile apps going to be very special as well. So
yes, I'm eagerly waiting
that's
for
coming up in a few days.
Yeah, within a couple of days.
Right. All right. Okay. So let's talk about Shivangini. So Shivangini is from a media background. She's a topper in the university in journalism school, one of the best in India. And she won't share that. So I'm going to mention it on her behalf. And you did some work in the media space before you joined us, right?
Yes. So I was working for the Times Group, and all these shows that you see on Times Group, Bloomberg, ET Now were produced by my production house, and I was their marketing and communications manager. So moving to this project, first of all guys, coming from the non-technical background, I congratulate you all because it is very fascinating to see a system like this coming to reality. And I coming from the media background, so I have this chance to interact with the nurses, with the doctors, with the end users, and I'm really glad that I'm able to document their feelings, their reaction, how do they feel about the system. So I would like to share one or two experiences. So yesterday, like on Friday, day one when we went live, so I was interacting with the patient. So I was like, oh, you have to wait because like we are going with new system. How do you feel about it? So she was telling me, though I'm a cancer patient and I'm in pain, but I still encourage this kind of digitization in a hospital because it's a step towards transformation, step towards change, which might change the overall healthcare industry in Trinidad and Tobago. And this is what it is. So I've been interacting with nurses. They are saying they are really happy to use this system. This is easy. This is time saving, and we don't have to fill in the data again and again. Some fields are auto-populated, and it saves their time, and they can spend that time actually interacting with the patient and getting to know them, treating them better. And I think coming from the media background, a project like this needs this kind of attention, and it should be heard. This is not just for the media publicity or stuff. This is a transformational game. It can be a game-changing thing for the healthcare industry. And I really want the masses out here and all the people to get in touch with us. We help us spread the word about it, because this is the change. If this thing works out well, you never know, we're going to change the healthcare industry.
That's the goal.
That's the goal. And yeah, one more thing, I have always believed if you can't tell anything, you can't sell anything. And the main point is we are not selling a product or commodity. We are trying to change the lives of the people through this initiative. So our work should be documented. That's what.
Absolutely. And so thanks for sharing all of that. But tell me a bit more about your experience on the ground. So what are some of the challenges that you found?
It's been really amazing. So initially I was very nervous. Like, I'm from a non-technical background. How am I going to...
Initially when you joined the company, or when you came to pharmacy for implementation of NWRHA?
Yes, for the first time. So I was very nervous that, how I'm going to help the nurses and the staff, medical staff out. But the system is so intuitive. I was just standing there with the nurses and the pharmacists, and they were able to fill out all the information. And if I see the system from a layman's perspective, even I am able to fill out the fields and I'm able to understand the system, which I've never done before. So the system is pretty good.
And then how's it been today?
It's been amazing. So far, so good. It feels months of hard work coming to an end.
And you're having fun with all the video and audio?
Yes, definitely.
Well, thanks for sharing that. So this was just to get the team together. It's right at the end of the day of day 2. So day 1 was Friday, day 2 was Monday. In my mind, I see Friday as kind of a kickoff or a bit of a pilot of the whole system. We want to make sure everybody has a PC, they're able to access the system, they will put records through, we fine-tune a few things over the weekend, and then today, Mondays are the busiest day, right, Magda? Yes, new patient day, plus a lot of patients come for chemotherapy, so we want to be all set for today, and I think today has gone pretty smoothly overall. Though we've still documented several items which we add on as improvements, right? To further refine the process and to further make it even more user-friendly. Because that's what's about. It's not just about putting the platform right, it's about incrementally improving it, about supporting it, making it even better for users and learning a lot more from there. And it's a big step in our journey towards establishing universal health information network and transforming global health. So thanks everyone, this has been very special for me as well, and thank you for everything you've been doing and for our team in India and New York. Without all the work you guys have been doing, this would not be possible. Another video but we definitely need to mention them.
Absolutely. Absolutely. Thank you.
Thanks, and with that, we'll wrap up this one.